Morning, family, friends and followers. Dr. Jimmy Henderson again, cognitive scientist. Today, Dr. Jimmy's tips, I want to talk about non-verbal communication and body language. Non-verbal communication means that people, through their body movements and their facial expressions and even the tone of voice, can convey messages to you which sometimes contradict what they're actually saying. So you've got to look for that situation where the person's body language and their non-verbal actually matches their verbal. Then you know that they are genuine about this. And this is very useful for counselors, for psychologists, and also in a social situation, in social settings, you can also use this. It's very, very useful. So let's go through the basic rules. The basic rules is there's 4 ways of non-verbal communication. The first is the facial expression. The second is the voice. The third is body posture. In other words, what is happening in here. And the 4th way is body orientation. So let's start with the first. The facial expressions. You can tell a person's emotions pretty quickly by looking at their facial expressions. You can see if they're happy or unhappy or cross or whatever the case is. You need to learn to look at the signs for happiness, for smiling, for not happy, for disgust, for anger, especially anger. Now, what makes it important is that you need to look for these things happening during your conversations or during your counseling. The second thing you need to look at is, or listen to in this case, is the voice. Is the person's voice high pitched? Can you hear the anger in their voice? Also the way they say things. In other words, I can't give a damn about this thing. That indicates anger. Look at the low voice. And you can almost hear the emotion in the voice, and you look at the facial expression as well. That also helps. Generally, when a person is highly upset or excited, their voice tone goes up. I am so upset about this. And if they are feeling depressed and feeling miserable, then their voice level goes down. I don't feel like doing anything. Then, of course, we come to the body movements. What happens is that when a person feels emotional, or also a thought which creates the emotions, involuntary changes take place in the body. They're not aware of it. And if you train yourself, you can become aware of this, and you can know what's going on in that person's mind or in their emotional state. But before we go on to the actual body movements, you need to understand that you cannot read in isolation. This old thing of somebody tugging on the ear means they like you, or brushing the lady brushing the hair means that she likes you. It doesn't necessarily mean that. People can sometimes they're uncomfortable, sometimes it's cold, sometimes it's noisy. And that can make a person's body language change as well. In other words, discomfort can also cause changes. So you have to look at the reason for the change in the body language, and that is very important. The reason. What did you say, or what did they say, or what happened? And you suddenly get this change taking place in the person's body, non-verbal and body language. So you're looking for the change, and you're looking for what caused the change. Sorry, I just had to go and put a jersey on. It's getting a bit chilly here at the moment. Okay, so the body posture, the openness or closure of the body. In other words, is the person's body open? In other words, they feel confident, they feel happy, they are willing to participate with you. The minute they start closing their body up, either by means of closing their arms, crossing the legs, or just, turning the way we'll do now, closing up the body, turning head down, arms closed, crossing the legs. And it happens in response to something that you said, or something or they've heard or seen. The second part of the body movements is body orientation. Now, body orientation means the way that the body is facing you or not facing you. In other words, you often see, you've heard of the cold shoulder. Now that means that the lady doesn't want to talk to you, and she then turns and she sits like this. So you've noticed the body language, the closure on the face, and her facial expression will probably be a bit unhappy. It certainly won't be smiling, and then the shoulder is turned towards you. That shows disinterest. It shows I don't want to interact with you, and it can happen during counselling as well. When you said something or the client is reluctant to speak, then they could sit away from you and sit at the body at an angle. They don't want to interact, so they turn away. Of course, it works in other direction as well, and they can turn away from you. And this can be combined with the crossing of the legs, as I said. So what you're looking for is a cluster of different things. You're looking for a changing body orientation. You're looking for the changing body closure. You're looking for the facial expression, and you're listening to the voice. Now, if all these things are sending a message, the same message, then you're definitely on the right track. As I said, there can be discomfort. The chair might be uncomfortable, and they'll do this and that, and it actually means nothing. It just means the chair is uncomfortable. But if you say something to them and they suddenly become shifting, or covering up, or moving away, or that sort of thing, then you know that it's something that you've said that has actually upset them. So I want you to make a note of these tips that you can use in your counseling, your social situations. And I must explain to you that all these tips are contained in one chapter in this book of mine. That's one of my latest books, A Comprehensive Guide to Crisis Counseling. It explains all the principles of body language, nonverbal communication, and how to read it. Very, very important. This book, as I say, is excellent for counselors as a training manual for counselors, or for anybody who does care work, nurses, doctors, anybody like that who wants to interact better with people and with their patients and clients.